Hi everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to go over fever or a high temperature after knee replacement surgery. What exactly does this mean? Is it normal? Is it abnormal? And discuss how to deal and manage this appropriately. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. So, when you have a fever after knee replacement surgery, a fever can be an indication for a handful of different things, and we'll discuss those a little bit more. But actually, in a lot of instances, a mild fever or mild, elevated temperature after knee replacement surgery can be a normal part of the healing and physiological processes that occur after surgery. And the reason for this is hypothesized that when you have a knee replacement, there is trauma, there's injury to the bone and the soft tissue around your knee joint. Now, as that tissue and bone and everything goes through the healing process, part of that healing process is initially inflammation. So there's going to be a lot of pro-inflammatory factors and hormones and things both at your knee but also throughout your whole body. And that's going to lead to an increase in temperature, potentially a fever. There's a lot of different information I found out there, but anywhere from maybe a third to half of people who have a knee replacement will probably have some mild fever. And usually this is early on after the surgery. So the first few days up to maybe the first 4 weeks or so after surgery, you may have a mild fever, and it may just be a normal part of the healing process. Now, of course, you want to have a very open and very good communication with your surgeon. Ask the surgeon, what body temperature should I look at to be a little more concerned? Or what symptoms, if I'm experiencing certain symptoms in addition to having a mild fever or maybe a little bit higher fever, should I be aware of and concerned about? And when should I contact, the surgeon's office to make sure we further assess this and see what's going on? Because, yes, a lot of times a mild fever is just part of the normal process, normal physiological process after surgery, but it also can be an indication for other more serious things that need to be managed and taken care of. Of course, the most common thing is going to be an infection. So this can be an infection at the joint itself, but it could also be other forms of infection. So there's a thing that orthopedic surgeons, or all surgeons probably use, called the 5 W's, and it's wind, water, walking, wound, and wonder drugs. So I'll go over these quick. So the first one is wind. So you want to think about possibly a chest infection. So this may be a collapsed lung or atelectasis. It may be a pneumonia. The next thing is water. So that means thinking about your urine or a urinary tract infection potentially. Next is walking, and this refers to the risk after surgery for a blood clot, either a deep vein thrombosis or a DVT, or that breaks off and becomes a pulmonary embolism, and both of those can lead to fever and high body temperature. There's also a wound, so possibly an infection at your incision where the wound is that the surgery was performed. And the last one is wonder drugs, and basically what that means is think about different medicines or different blood products if you had a blood transfusion with surgery that can also possibly lead to an elevated body temperature and infection as well. So there are definitely some risk factors and things that a high body temperature may indicate. So again, it's very important to have that discussion with your surgeon of, what's the cutoffs? What body temperature should I be concerned? Should I contact the surgeon in the surgeon's office? What symptoms do I need to be aware of if I have a fever that's accompanied with these different symptoms? When should I contact the surgeon? When should I be concerned? And when should I just, understand that it's just a normal part of the physiological process? For most people who have a fever after surgery, if it's a mild fever that's just a part of the normal, physiology and inflammation after surgery, usually that fever will start to decrease slowly over time. So that's something to look at as well. But again, this is just for informational purposes. It's extremely important to have that conversation and have that communication with your surgeon, as they will best know when it's just something that is not worth being concerned about, or it's something that requires some more examination and assessment to understand what's going on. I hope this video was helpful and insightful. Please be sure to leave your comments or questions below. Please be sure to hit that like button if this was helpful so we can help spread this video to others who may benefit. Thank you very much for watching.